Hello there. My name is Sank, and I am part of the California School-Based Health Alliance team that is bringing you the series of webinars. Today, I'm going to be presenting on Module 2, which is focused on planning, collaboration, and partnerships. So welcome. Again, my name is Sank, and I'm a consultant supporting the Inland Empire region, and I'm so grateful that all of you are taking time to watch this video. I think you may already know about the California School-Based Health Center. If you've watched previous webinar recordings in the series, we are a statewide nonprofit organization dedicated to improving the health and academic success of children and youth all over the state. And we do that by helping to put healthcare in schools by way of school-based health centers and wellness centers. And we are a membership or based organization, so we invite you to become a member today in order to receive an array of benefits. And there is a QR code there for you to scan if you want to become a member. Um, like I mentioned, today's module is really around the planning, collaboration, and partnerships. And so we'll go into a little bit of what that entails. And specifically, excuse me, I guess I'm okay. Specifically, we're going to be looking at conducting a needs assessment, including the assessment and asset mapping itself. These are the learning objectives that we'd like for you to be able to achieve by the time the session ends. And that includes being able to identify tools for conducting your needs assessment, being able to conduct an asset mapping to identify what you currently have and really how to use what you already have to expand services, and then to be able to translate those needs assessment findings into an actionable plan. I want to go over a few tools, not in much details, but just to kind of give you a sense of how you can use some of these in your own assessment. So we'll start with a community health assessment. Every county's public health department will be able to share a community health assessment, which usually takes place between 2, 3, or 4 years. It's really a population-based survey that they do to be able to present data on how community members are doing in the county in terms of physical health, mental health, environmental health, and just a whole host of other indicators. So here I'm going to show you a couple of data points that San Bernardino County Public Health has been able to collect. This is the latest report from 2020. I know that a new one will be coming out any day now this year that really reflects more recent data. And you can certainly find the report on the website, but this is what the cover looks like. I'm just going to share a few slides, like I mentioned, highlighting some of the data. And really, we think about education as one of the social determinants of health, and really how important education plays in the role of health outcomes and health status. And so here, this is looking at percent of cohort high school graduation rate by district. So I'll pause and let you all take a look at this to find out where perhaps your district is, and this is over the period of 4 years. There are a few districts that are highlighted in star or that are marked by stars, and those are districts that are doing really well and above state average, and they include Juneau Valley, Hesperia, Needles, Redlands, and then Upland Unified. This here shows a school safety rate by school or district, and this is asking the percent of students who felt safe or very safe at school. And again, oh, not again, but I did mention this earlier that the data report doesn't always include all districts. It's really based on what's available. And so let's take a look here. I like to focus on Chino Valley. You can see here in 7th grade, students felt safer in younger grades and in older grades, ranging from 73% to 63%. And This kind of data is important because it does allow us to think about what we can do in terms of service providers and other school personnel and really creating a safe space for our students. Because when they come to school, they want to feel safe. Parents want them to feel safe, but also that really helps to create a campus climate where students can be themselves, can feel like they're learning and thriving. And so these are the kinds of data points that I think is really good to use in thinking about how to not only provide specific school-based health services, but a lot of the programming that school-based health centers provide in terms of building that school campus culture. I'll move on to the next tool, which is a California Healthy Kids Survey. Again, this is another statewide population health survey. And this is what the dashboard looks like if you go onto the website here. And we'll have the URLs, I think, in some of the handouts that will be posted later. But I just show here the number of dashboards available. And when you get to that dashboard, you're able to look, but parse out the data either by, statewide or county or district, and then the domain, what specific areas of health do you want to look at, and then to actually select the type of measure you want. So here we are looking at Chino Valley Unified, which is the county of San Bernardino, and we want to look at their social emotional health, and more specifically, chronic sadness and hopelessness for all students. But again, you can look at disaggregated data by particular student characteristic, such as what is listed here below. And so let's look at this one to start off. And this is uh, the percentage of students who experience chronic sadness or hopelessness during the past 12 months. Here you can see in 11th grade, 42% of students reported that they actually did experience chronic sadness. And you can see here, the higher the grade, the higher the percentage of students who feel chronic sadness and hopelessness. So again, in thinking about mental health services and thinking about tiered one work, what do you really want to focus on and at which grade level? And here you can see that, focusing on older students at the high school level, is probably more needed. I mean, it's needed in all grades, but particularly in the higher grades. This is a California Student Health Index. I won't go too much into this because we actually do have a module that goes into more details about what this is. And this is actually our CSHA homegrown index that we're very proud of and that we've been made available. It's been made available for the last number of years, last few years now. The Student Health Index is the first statewide comprehensive analysis to identify counties, schools, and districts where, if you look at the map, you can see which high school or which areas would have the greatest return in terms of your investment in providing school-based health services. And so that really helps us, help all of you do some, assessment in thinking about, if I only have so much resources and I'm in a school district of, say, 8 high schools, which one should really perhaps be prioritized? And that's what the Student Health Index will help you do. Just a couple of screenshots of what that index looks like. And here is one. We use Tableau to host the index. And here, these are dots that indicate, the high school, or not high schools, just, the programs throughout the state that, could really benefit from health services. And the data includes looking at census tract, from things like health and healthcare indicators, to socioeconomic indicators, and then school level indicators as well, which many of you, I'm sure, are very familiar with. And here is just some of the data that were be able to extract from the Student Health Index. Here is looking at the top 10 counties with the highest ratio of high need schools to all schools. And for our region, San Bernardino actually ranked fourth in terms of being the fourth highest need counties. And for the schools that we have highlighted, these are considered high need schools, which means that, overwhelming majority have students who are eligible for free and reduced lunch, which is a proxy for poverty, and then students of color. I'm going to move on to the next data source, which is for conducting needs assessment, which is kids data. And this is a really another great tool and really powerful tool to help paint the picture on how your school or community or county is doing. So this is a screenshot of what the data portal looks like. And I put a screenshot of what we're looking at for San Bernardino County. And so you're able to go into this portal, into this website and parse out data by topic, by region, by demographic information. And in here, on this screenshot here, we're looking at data by region. So for San Bernardino County, you can see here a breakdown in age groups by gender as well as total. So here, let's just hone in on, you know, student, age children ages 6 to 10 in the county. It's about 160,000, which is quite significant. Here, using the same data portal, um, is kids data. This is looking at students who are either overweight or obese. And so I put here both San Bernardino County as well as San Bernardino City Unified. And let's just hone in on grade 7, which is the lightest purple here. And here for San Bernardino City Unified, it's, a few percentage points higher than San Bernardino County. And so, and you can also see here that for grades 5th and 7th, the school district is quite a bit higher than the county as a whole. Another great resource mapping is looking at where community clinics are as well as mental health clinics. And here in the region, we do have a consortium called the Community Health Association Inland Southern Region, or what we call CHISER. And if you go onto the website, you can actually enter your address and it'll pop up which community clinics are nearby you. And that's a great way to start thinking about, what health providers are in the area that could really potentially be partners in your school health delivery program. For the mental health side, we do have SAMHSA, which is the Substance Abuse and Mental Health Service Administration, which is the federal department for mental health. They do have a treatment directory that you can also go to, and it's just findtreatment.gov. And again, it's similar to the Chiser one where you enter your address and it'll pop up using a radius point where the local treatment areas are for you to consider either adding as a referral source or thinking about partnerships. I also want to share now the resource mapping, the steps and templates, a few that I'll share. Steps of resource mapping. Here are sort of how resource mapping is done in stages. There's the pre-mapping stage, which is really where you put together a clear vision and as well as your goals on what you want to get out of the mapping process and really what the infrastructure and the process looks like. For step 2 is the actual work itself, the mapping itself. And here is where you actually identify what resources are available to students and their families, both inside and outside of school. And the third stage is looking at how to maintain, sustain, and evaluate the mapping. And so here you look at the strengths and challenges, what are gaps in resources and services and programs, and to be able to really come up with your own system on how to ensure that your resource mapping process stays current and that you revisit it on a regular basis so that way we don't have out-of-date information to share with our students and their family. And what is it that you want to map? Excuse me, I just stopped reading. I'm going to go back. What is it that you want to map? And so this is just a screenshot of a worksheet that is available to you in thinking about what resource do you want to map? What is the scope of your matching project? For example, do you want to look at programs that are within a 5-mile radius or the 10-mile radius? And or do you want to just look at tiered programs? And this really helps you hone in on what it is that you want to do as part of the discovery process. And I mentioned earlier a tiered, version. This is very familiar to all of you here in thinking about what are the most pressing mental health or behavioral health issues that are impacting our students. And you can think about that by way of the tier, tier one, tier two, tier three. And I want to also mention that at the California School Based Health Alliance, we have a plethora of resources to support your planning process. And these are some of the tools that we have on our website. The first one is our Vision to Reality Toolkit, which is what some people call the Bible of school-based health centers. Here you're able to really go chapter by chapter, look at how to plan your school-based health center, along with a lot of examples of worksheet and and forms, whether it's consent forms or surveys or what have you, you're able to find all that in the index. The other one is a short guide that's called Steps to Planning, and this is really, sort of an abbreviated version to the Vision Duality Toolkit, but just very concrete steps to be able to plan how to build or expand your school-based health center. And then we also have a best practices checklist where these are the things that we as a state alliance work with the field to come up with in terms of like what's really working best in terms of strategies and things to focus on in school-based health centers. And so here's a QR code to be able to take you to just a number of resources on our website. And we want you to stay connected to us. And so these are all the different ways you can. Thank you very much for your attention on this brief webinar.